I'm Professor Janette Vardy. I'm a medical oncologist where I work at the Sydney Cancer Survivorship Centre at Concord Hospital and a Professor of Cancer Medicine at University of Sydney. So we started the challenge study 17 years ago, and what we were interested in seeing was whether physical activity could actually decrease the risk of a cancer recurrence and could improve survival for patients with colon cancer. Colorectal cancer is the third most common cancer worldwide, and it's the second leading cause of cancer deaths worldwide. So this is very significant. More than 20 million people have colorectal cancer. So this is the first global study, and it was a randomized control trial. This was in patients with colon cancer or bowel cancer who had already had surgery and then went on to have chemotherapy. And then 2 to 6 months after they finished the chemotherapy, they were randomized to one of two groups. One group were given health education materials promoting physical activity and nutrition. And the second group, in addition to those health education materials, had a structured exercise program. We're very excited with the results, which have shown that we were able to see quite a significant difference in the amount of exercise that was being performed by the two different groups. But most importantly, we saw a difference in both disease-free survival and overall survival. So we looked at 5-year disease-free survival, and what we found was that 80% were alive with no evidence of a recurrence of their disease at 5 years in the exercise group, and this was compared to 74% in the health education only group. And this actually equates to a 28% reduction in the risk of having a cancer recurrence. Importantly, overall survival, which we looked at over an 8-year period, was 90% compared to 83% in the health education group only. And again, this equates to a large difference. This was a 37% reduction in the risk of death. So each participant worked with their exercise consultant and they came up with an individualized program. But the big aim was to increase the amount of their exercise from baseline by an equivalent of, say, 150 minutes a week of brisk walking. So that's only 30 minutes 5 times a week of brisk walking that we're talking about the difference to achieve these sorts of results between the two groups. This should really change the standard of care for colon cancer patients worldwide, and it may even be able to be generalised to other cancer groups. But based on our results, what we should definitely see is that a structured exercise program should be being offered to people at the latest for when they finish their chemotherapy. Now, we know that just telling people to go off and exercise isn't enough, because the control group, if you like, or the group that got their just the education material, they were told to go and exercise. So clearly the intervention was able to really help to make that difference. So we need to be bringing in for people that at the end of chemotherapy, they're given sessions with someone like an accredited exercise physiologist. They're given a prescription to exercise and given the assistance to be able to do that.